Assalamu alaikum dear students, welcome back to my YouTube channel. Today we will discuss most important MLT medical laboratory technology MCQs. Z-Nielsen stain is used for option A gram positive bacteria, option B acid fast bacilli AFB, option C fungi, and option D parasites. So the correct option is B, acid fast bacilli. Here is very short explanation is Mycobacterium tuberculosis retain carbofloxacin A1 after acid alcohol wash due to mycolic acid. Anticoagulant used in ESR by Western green method is option A ADTA, B sodium citrate, C heparin, and option D potassium oxalate. So the correct option is B, sodium citrate. Explanation: sodium citrate prevents clotting and maintains red cell shape for accurate ESR measurement. Subscribe now and press the bell icon. Never miss an update from early technologist. Normal hemoglobin value in adult male is option A 10 to 12 gram per deciliter, B 13 to 18 gram per deciliter, C 8 to 11 gram per deciliter, and option D 18 to 22 gram per deciliter. So the correct option is B, 13 to 18 gram per deciliter. Explanation is hemoglobin carries oxygen. Normal range for adult male is 13 to 18 gram per deciliter. The reticulocytes are stained using option A gram stain, B Gims stain, C methylene blue, and option D Leishman stain. So the correct option is C, methylene blue. Explanation: reticulocytes count. Reticulocyte contain RNA, which is stain blue, with supravital stains like methylene blue. PT, proton beam time, measures which pathway? Option A intrinsic, B extrinsic, C common, option D both B and C. So the correct option is D, B and C. Explanation: proton beam time elevates the extrinsic and common pathways of coagulation. Okay dear students, gram staining differentiates bacteria based on option A shape, B size, option C cell wall composition, and option D capsule presence. So the correct option is C, cell wall composition. Explanation: gram positive bacteria have thick peptidoglycan wall, while gram negative bacteria have thin peptidoglycan wall. Universal donor blood group is option A positive, option B B negative, option C AB positive, and option D O negative. So the correct option is D, O negative. O negative has no A, B, or RH antigens, making it compatible for all. Coombs test detects option A hemoglobin defects, B antibody against RBCs, option C platelet count, and option D clotting factors. So the correct option is B, antibodies against RBCs. Explanation is used to diagnose hemolytic anemia and cross-match blood. The shelf life of whole blood at 2 to 6 degrees centigrade is option A 14 days, option B 21 days, option C 28 days, and option D 35 days. So the correct option is D 35 days. Explanation is whole blood stored with cpDA can be preserved up to 35 days. Most common stool parasite is option A Entamoeba histolytica, option B Giardia lamblia, option C Scaurus lumbricoid, and option D hookworm. So the correct option is B Giardia lamblia. Explanation: Giardia is a flagellated protozoa causing diarrhea, detectable in stool samples. Vidal test is used to diagnose option A malaria, B typhoid fever, C leptospirosis, and option D brucellosis. So the correct option is B typhoid fever. Explanation: Vidal test is used to detect antibodies against Salmonella typhi, which is O and H antigens. Dear student, this is very important MCQs. In hematology, ESR stands for option A erythrocyte sedimentation rate, option B enzyme sediment reaction, option C eosinophil specific reaction, and option D erythrocyte solution ratio. So the correct option is A erythrocyte sedimentation rate. Explanation is ESR measures the rate at which a red blood cells settle in tube in 1 hour, it indicating inflammation. Normal fasting blood glucose level is option A 50 to 70 mg per deciliter, B 70 to 100 mg per deciliter, option C 100 to 130 mg per deciliter, and option D 130 to 160 mg per deciliter. So the correct option is B 70 to 100 mg per deciliter. Explanation is fasting glucose above 100 mg per deciliter indicates predictable pre-diabetes mellitus. Normal is, so the normal range for normal fasting blood glucose is 70 to 100 mg per deciliter. Hyperkalemia is an increase in option A calcium, B sodium, C potassium, and option D chloride. So the correct option is C potassium. Explanation: hyperkalemia refer to elevated blood potassium which can affect heart rhythm. The stain is used in pap smear is option A Zell-Nielsen, option B Gram stain, C Papinaculo stain, and option D James stain. So the correct option is C Papinaculo stain. Pap stain is used to detect cervical cancer and precancerous changes. Platelets are produced in option A liver, B spleen, C bone marrow, and option D thymus. So the correct option is C bone marrow. Platelets originate from megakaryocyte in the bone marrow. This is so important in MCQs. Decalcification is essential before cutting sections of option A liver, B bone, C brain, and option D lungs. So the correct option is B bone. Explanation is calcium must be removed from the bone tissues for soft cutting and sectioning. Which instrument measures blood glucose? Option A hemocytometer, B spectrophotometer, option C glucometer, and option D centrifuge. So the correct option is C glucometer. Explanation is a glucometer is a portable device for rapid glucose measurement from capillary of the blood. Malarial parasites are detected in option A, stool sample, B, blood smear, C, urine samples, and option D, sputum. So the correct option is B, blood smear. Explanation is thick and thin blood films are used to stain Giemsa to detect malaria parasite. The main principle of ELISA test is option A, agglutination, B, precipitation, C, antigen antibody reaction with enzyme label detection, and option D, color change by acid. So the correct option is C, antigen antibody reaction with enzyme label detection. So explanation is ELISA is used as an enzyme to amplify antigen antibody binding, producing a color change. This is very important MCQs. Most common fixative in histopathology section is option A, alcohol, B, formalin, C, acetone, and option D, iodine. So the correct option is B, formalin. 10% buffer formalin is mostly used routine fixative to preserve tissue structure. WBCs are counted using option A, Newbar chamber, B, spectrophotometer, C, colorimeter, D, refractometer. So the correct option is A, Newbar chamber. Explanation is the hemocytometer like the Newbar counting chamber is used for manual WBC counting. Acid-fast bacilli retain which dye? Option A, crystal violet, B, methylene blue, C, carbolfuchsin, and option D, safranin. So the correct option is C, carbolfuchsin. Mycobacterium tuberculosis retain carbolfuchsin stain even after acid wash due to their waxy cell wall. The main function of platelets is option A, oxygen transport, B, blood clotting, C, immunity, and option D, hormone transport. So the correct option is B, blood clotting. Explanation is platelets help in homeostasis by forming clots at injury sites. Thank you for watching my videos.